Pam Seefeld. Oh my God. Here's one of those people that you can't measure with any yardstick. She's got info way outside the box.
In the bloodstream, and a lot of the D, if it's actually low, say it's in the 30s or the 40s, a lot of times what's happening is that it's bound up to receptors.
I've not met anyone that's even paralleled to her. She's a clinical pharmacist who owns Botanical Resources, and the people that work with her just love the fact that they're helping others with natural products. They're giving people substitutes so that it will be the right choice for the receptors in that body to not be dependent on those conventional medicines, those antidepressants, those petroleum-based products that she, like herself and others, want us to get away from. We enjoy that fact. We think Pam Seefeld is a real find because when it comes to anxiety before a dental appointment or the need for an opiate afterwards for pain or even a natural antibiotic, she has the licensure and the ability to discern what that person really needs that will be a natural product. That's a huge resource for our community here in Clearwater. I submit to you that you enjoy Pam Seefeld's litany.
My name is Pamela Seefeld. I'm a clinical pharmacist and also a pharmacognosy consultant. When I was studying to be a pharmacist, I took the classes for pharmacognosy. They do not teach this anymore, and pharmacognosy is natural product medicine. So the difference between the pharmacognosy and herbalism is that herbalism basically is kind of like a non-science in itself, and they're just looking at the mechanisms that the plants have and the energetics of the plants. But in pharmacognosy's realm, it's actually what plants contain certain specific substances and where they act in the body, and it's the chemistry behind the plants. So my background is chemistry of natural products and how they work in the body and what receptors they do have activity on. So in the pharmacology realm, I specialize in medications in place of psychotropic medications. Okay, so there's natural products. So if you look at regular medicines, especially for anxiety, typically they'll use a type of medication called benzodiazepines. And benzodiazepines are a specific class of medicines, and they include, not limited to, Xanax, Ativan, Valium, and also midazolam, which they use most of the time as a pre-op for surgery. Okay, so these medicines work on the receptor called the benzodiazepine receptor, and drugs work on a receptor. Receptors are proteins that are embedded in the cellular membrane, and the protein has a specific configuration that matches the drug exactly. So I kind of explain it with my hands that here is the receptor and here is the drug, and when the drug comes on the receptor, it's called a full agonist. And a full agonistic activity means that its configuration looks exactly like the protein on the receptor. This receptor then allows a chemical change inside the cell, and that chemical change makes the person relaxed. So in the natural product pharmacy realm, which I specify, and looking at how can we use this receptor to our advantage with natural products. And one of the natural products that has high activity for this receptor is called passion flower. And passion flower is an herb, but it also can come in tinctures and in tea. I personally like to use the capsules because you're getting all of the components of the passion flower, and these specific components are called partial agonists to the benzodiazepine receptor. So what a partial agonist means is that it comes on the receptor, it comes off the receptor, it comes on the receptor, it comes off the receptor. It's not the exact configuration, but it is a very high specific match. And when you do this, it can either kick off the drug. So if you're trying to get somebody off of these medications, which have the problem with these medicines, they have addiction and tolerance. So tolerance and dependence are the problems. Tolerance means I need more medicine to get the same effect. Dependence means sometimes I have psychological and physical dependence where I feel like I'm going through withdrawal if I don't have the medicine. So we want to avoid that in patients if possible, because trying to come off of the regular pharmacologic agents is very, very difficult, and most people don't have high success with that. So using the passion flower, you get this agonistic activity, you can kick off the drug, and basically you're faking out the receptor in the body. the body does not know, do I have the drug on the receptor or do I have the herb on the receptor? And so it's a very effective tool to get people off of prescriptions. But if somebody wants to use this and not go to the prescriptions and have the anxiolytic relief that they're looking for, or use it as for sleep as well, they can use passion flower in place of these drugs and never end up with addiction and intolerance, which are two very, very serious side effects that most people just do not want to confront. If we're looking at dentistry, typically we're going to use just 3 classes of medicines, right? You're going to be using an anxiety medicine, probably the benzodiazepine class. You're going to be using maybe an opiate for pain. You're also maybe going to be using some kind of antibiotics, but we're going to focus really on the anxiety issues. So people have anxiety going to the dentist, and they want to have effective pharmacological agents that will help them release some of this anxiety before they have their mouth operated on. And that's understandable. So passion flower can be very effective in these patients because perhaps they do not want to use a benzo and a full agonist to the receptor. In the dentistry realm, we know that using passion flower can get the person relaxed, and they tend to tolerate the procedure better. And in this particular instance, you don't necessarily need to go to prescriptions, and the prescriptions have lots of dangerous side effects that most people probably will not tolerate, especially if they're drug naive. What does drug naive mean? Drug naive means you've never been exposed to these medicines before. Now you're given this medicine, and we're really not always sure how it's going to react in the body. When you take an herbal medicine, its metabolism is different in such that it releases through the body. It's going to be pretty consistent for several hours, and then after that you're going to be able to go home and drive a car. Whereas if you use a benzodiazepine, there can be hangover sedation, and it can affect cognitive ability. Those patients that have already been on prescriptions, we would probably use more of passion flower and maybe even use another product, a homeopathic product, along with it, so we have an adjunct. So this person would probably need more of a tailored regimen. If a person really never takes these medicines, they could probably go ahead with the regular passion flower dose. And typically, I would always recommend, just to make sure that it's working well for you, to maybe a few days before, try it while you're at home and see how it affects your body, because we can always adjust the dose based on this person's individual chemistry. Many times when people are taking passion flower, I will recommend something called Pro-DHA, which is a calming, focusing fish oil. It was originally designed for ADD for kids, but I use it a lot for adults. And what this has is the effect on the brain makes you kind of like not worry about things. It turns off that obsessing and that thinking in the back of your head that, oh, I'm concerned about this, or I'm really worried about this. And so as an adjunct with the passion flower, it'll take the edge off and make the person a lot more relaxed and have a much more happy result to their procedure. We know that when you have a dental procedure, you're actually having inflammation. There's cutting of the tissue, and there is some areas there that are going to be inflamed as a result of it. So you need to have some type of a pain reliever that's natural on board post-op, so that you can start obviously getting back to yourself. Ibuprofen 800 milligrams, which is a prescription, and it's very good for pain and for inflammation. You can use curcumin in place of that. Turmeric and boswellia have lots of clinical data that show that it works very specifically for pain. The curcumin, probably, I would say an 800 milligram of ibuprofen would be equivalent to 3 capsules. So, and it's important when you take curcumin that in passion flower not so much, but curcumin as well, that as far as food affecting the absorption, curcumin, the turmeric and the boswellia require some amount of fat to be absorbed. So if you take it with a pear or something that doesn't have any fat in it, and I'm not talking a lot of fat, it can be even a handful of almonds, a small piece of cheese, but the taste of fat in your mouth releases bile acids in the stomach, and as a result of releasing the bile acids, you get this peak in the bloodstream in the small intestine, right? So if you don't have that peak in the bloodstream, it's not going to be as effective. So that's why I always tell people that you want to make sure you have a little bit of it. Just even the taste of oil in your mouth releases bile acids into the gut and allows for these things to be absorbed very effectively. we have inflammatory cytokines that are being released into the bloodstream, and now we know that they are pretty significant, especially if they're in the adipose cells and they're releasing all these cytokines. That's why people, then they're overweight, they tend to have more pain problems, and the result of that is because these cytokines are circulating in the bloodstream and they cause you to eat more, have inflammation is increased in the body. And we know about people, if they're not taking good care of their gums, really, I would really like to see that they might even correlate that someday with weight gain, because the circulating cytokines that are being released in the fat are also affecting the gum as well. So we have to see that these are all encompassing. Your poor dental health and the problems in your mouth might actually be making you overweight as well. The person's dental problems are just a sign of other things that are going wrong in the body. That's not the sole problem that we're looking at. We're looking at, is this all encompassing? And we know there's lots of statistical data that show that gum health and teeth health are correlated with all kinds of diseases in the body. So if people aren't taking care of their gums and their teeth appropriately, you're going to end up with heart disease, strokes, lots of other problems that can be really prevented. Most of the time I'll sit down with a patient. You make an appointment here. It's a free appointment. It's usually about 15 to 20 minutes. And if you have any blood work from the last several years from your allopathic doctor that shows your CBC and your CMP, which is all like your blood work, your complete blood work, your thyroid perhaps, I can sit down with you and look at those numbers and I can tell you exactly what's going on in your body. Because a lot of times, most times, regular physicians, they look at something if it's out of range. So that's the only time they ever flag it, if it's out of range. But maybe there's something else going on, and I cannot tell you how many times I see people that are at risk for kidney failure or other issues that no one's even catching. And I'm like, look, this is how we practice in pharmacy and as regular doctors. We wait till there's a problem, and then we give you a bunch of medicine. So if you don't want to do that, I always tell people you're kind of like before the misty bridge, and I'm the psychic here, and I'm telling you what's on the other side of the bridge. So if you want to go over the bridge and be on these 5 medicines, and I tell people we can triage it. You want to wait a little while, that's fine too, but I will promise you, you will be prescribed these particular medicines and within 2 to 5 years. And when you come back and tell me that I was correct, just let me know. But I mean, in sarcasm and all kidding, we really want to prevent those things. And so we can use homeopathy, we can use vitamins, and we can use these tools to prevent these things altogether. They can go back to their doctor, recheck their blood work. It always comes back normal, everything's cool, and then we decide, are we going to continue this, and triage if there's any other issues we need to address. But that's really what it's all encompassing, is preventing all of this chronic illness that's very preventable with some simple supplements and is very inexpensive.